Osteoarthritis is a big issue laden with fear because many people fear, oh, osteoarthritis, artificial joints, and so on. Today I'll explain everything about osteoarthritis you need to know so you can deal with it nice and relaxed. And you're going to hear stuff you probably haven't heard before, I just figure. Let's start easy. Right from the start, this applies to all joints, the tiny ones in your fingers and the larger ones like the hip as well. And the spine too. It's built a bit differently with many small joints. But everything can also be transferred schematically. Look, a joint is always built in the same way. There are at least two bones, so we pick an example bone here, one like this, and then beneath it, another bone comes in, joining the first at a point to form a movable connection. And they are shaped, and wherever they are, move against each other in relation to one another. And a joint is always set up the same way. It's got these two bones, and then here's the capsule. And the capsule holds it together, keeping everything stable and secure. And that naturally creates an inner area of the joint here, so to speak, essentially. And now, of course, we have the cartilage. That's what osteoarthritis is usually about. And the cartilage here is basically attached so it glides smoothly and evenly along the opposing surface with minimal friction. One from the bone down here and one from the bone up there facing each other quite closely. And then sometimes there are little dots, the synovial fluid indeed. It's produced by the synovial membrane. That's basically the inner lining of the capsule. And those are protein building blocks, all the building blocks the cartilage needs for its nourishment, for its regeneration, and for repair processes and so on. And it's always similar. The shape of the joints may be different, but the principle is always the same. And then the muscles come, and the muscles are the motors that move the bones. We'll just keep it really simple now. Let's say a muscle pulls in this direction, yes, in that direction. And whenever the bone moves over it, whatever shortens here has to lengthen on the other side to compensate for it, so the system balances out and the joint can keep working smoothly. So here we've got the opposite side, say this one. And along this axis, the lengthening takes place, extending outward. Everything that's there has to give way when it contracts for this particular movement. And if the movement goes the other way, it tightens up here and must give way over there slightly. And the whole thing always has, of course. A little effect right here on the joint itself, because just imagine. It's being pulled, and then there's a certain counterpull. We'll get to that in a moment. And there is always a resultant force into the joint, and the cartilage down here also needs a certain degree of pressure to function. It needs functional pressure because it has no direct blood supply and therefore depends on that for nourishment. So how do the nutrients get in and how do the waste products get out? That happens by diffusion. That means picture a sponge. When you squeeze it, whatever's inside gets pushed outwards into the surrounding area. That squeezes the dirt out. Then you take the squeezed sponge and dip it once more into some clean, clear water, and it can fully soak up perfectly clear water. And this happens all the time when you move. And I'll tell you why we'll come back to this. I'm convinced that when a joint is moved, if the forces are right and the building blocks align, it will consistently work as intended. The building blocks needed for it to regenerate are in your body from your diet, of course. If that's the case, a joint can easily last for at least an entire lifetime. Yeah, and you don't have to get osteoarthritis or end up in pain. And nothing needs to be fixed or anything. It just lasts because it keeps regenerating. The body is a living system of cells. It's not a car. Yeah, where a tire's worn and you'll have to change it sooner or later. A tire doesn't grow back. Cartilage, though, is constantly regenerating. But like I said, we'll come back to that in more detail. For now, let's get into the biomechanics that are at work. We said that a force from certain muscles, from one muscle or several, pulls on it, and then the cartilage moves in that direction. Now, we always have some opposing tension. And we say indeed that this opposing tension is controlled directly by the brain's neural commands. And this opposing tension is a control voltage, as we call it, which ensures that through certain internal mechanisms, voltages sent to the muscles, it's all ultimately guided by the brain, by the motor center, which ensures that the movement takes place in a carefully controlled, orderly fashion. happening in a controlled way. What does that mean? Imagine. There's a maypole lying on the ground. That's a really long tree. They're, I don't know, 10 meters tall or maybe more. And now the maypole is going to be put up. And there's a thick rope fastened here. And then 3 or 4 strong people stand around and pull on it together carefully, and it slowly tilts upright more and more until it's fully standing, until it's upright. But now imagine they pull a bit too hard, then it'll fall over onto the people pulling it. Or while they're pulling it, it swings off to the side and then somehow falls into one of the buildings there or something, crashing into walls or balconies and causing quite a mess. So what do you see when the maypole's being put up? It's 3, 4 strong people pulling on one side, and on the other side someone's standing with a thinner rope. He's holding them back. You think, that's dumb. Why is he doing that? Then the force isn't nearly as strong anymore to get the maypole up, but he's basically just holding it steady. He's holding it with his rope to feel how it moves, so he doesn't get dragged along unexpectedly by the pole. Because if it's pulled here and pulled back there, then he's completely under control and perfectly steady throughout, and then nothing can happen anymore. So the exact same thing happens right here in the joints too. Because the type of movement here in the joint is dictated by the body and by its inherent anatomical structure and overall biomechanics. And the moment the body knows that, through the movement programs it's trained, it then optimizes that movement further over time gradually. So if you try to move the bone there, a certain control tension automatically kicks in to resist. To let the movement happen in a controlled way. And now you think of physics or math from school, or maybe learned it somewhere else, the parallelogram of forces. So now we've got a drawing method to show what total force results from these 2 forces and how they combine in magnitude and direction. And you do that really simply. You draw a line parallel to one of the forces. The direction of this force runs parallel to the other one. It's approximately here. And there's an intersection. And now basically the resultant. Force from the force meant to move the bone and the switched control voltage acting together to produce movement. And all that, like I said, is highly training dependent. The body keeps fine-tuning it because it wants the joint stable and that it's loaded properly. And proper loading means enough so the cartilage gets fed. But for example, something sliding where it should be rolling, that kind of thing can't happen because it causes more wear than the body might be able to repair. But here's what happens. We simply don't move nearly enough anymore. And above all, we don't move through all the ranges of motion we should be using. That means if this joint here would actually have been meant to, I'll just do it. I'll shade that in black now so you can tell it apart much better, okay? Yeah, like for example, I'll do it here. In this direction and in this direction, that would be the full range of motion of this joint, showing exactly how far it can swing both ways in normal use and what limits its movement in practice. Yeah. Then, that means if this bone is moved up to here and over to there, everything gets used, all the fascia and muscles without any exception at all. The ones connected to it always move along in that direction. I'll just show you a quick hands-on example for you right now to illustrate this. With the arm. So here on the arm, we've got the flexor muscles. They're a bit shortened now, but not completely. Then the arm would be here, so you can clearly see how the joint would sit in that position. And when the arm's straight, they're really long and pulled tight along the forearm, almost completely taut. The other side, the extensor muscles, is really short now. And when I bend, this one on the side really has to lengthen a bit more and stretch out. Okay? So if you keep doing this and this repeatedly, nothing's going to shorten there. But we don't do that. So I always say, of the movement angles built into us, the ones we should really be using over and over, we use at most 10 to 20%. For some joints, it's actually even much less, dramatically so, because what exactly happens? The moment we're a living system, like we said earlier, when the living thing is actually here and present right now indeed. If it isn't pulled completely apart for a long time, it then gradually loses the ability to give way sufficiently. Because it thinks, okay, if this person always keeps me that short, then I'll adapt myself accordingly. That goes for the muscles and for the fascia too. You can't really separate them anyway. They're inseparably connected, so to speak. And then it gets harder and harder to fully straighten out over time. And vice versa is true. If I never fully bend, but always just keep doing that same little repetitive movement, then this side will keep shortening over time, and sooner or later it'll get quite noticeably harder to do the full bend here. Let's map that onto our example. So first of all, it basically turns out like this. Oh, I haven't made that quite clear yet, so let me put it a bit more plainly here for you now to avoid any possible confusion for everyone. So that means if I try to straighten out now and the flexors aren't used to it anymore, they'll just end up pulling back against me a little. Then they pull against me, and that means I can still straighten out, but there's a real counter force that immediately kicks in. Okay? If now, by me not moving this and the opposing force reaches all the way up to here, let's say, then I've got the first small practical problem to deal with. Just so you understand, the control voltage can always be finely adjusted by the brain so that it's absolutely perfect indeed, if the brain decides, based on all its measurements in and around the joint itself. We need a low control voltage so the output stays noticeably smaller. If it needs to be larger, the brain simply adjusts that setting automatically. That means it's totally flexible, like what's best for the body. But the fascia are this network, this spider web network that runs through everything. And when the fascia get matted and stop giving as much, they start to restrict movement and can cause stiffness throughout the body. Then the brain can't fix it. It can't go, oh, fascia, you're bugging me. Give a little more now. Will you just please, though? That doesn't work. It's basically a rubber band effect that keeps tugging all the time, and the body can't change it anymore. And that means if a fixed force reaches up to here, then every time I move the arm, the bone over there, there's basically this opposing force resisting the motion and acting continually opposing the movement at every step. And if I now draw the parallelogram of forces, then my resultant force is right here at this exact point. You can see it quite clearly. That means, for example, if there's a bottle here that I want to grab, then with the force I would actually need, I can't grip the bottle anymore. I simply can't get a proper hold on it at all, because I'm being pulled off somewhere by that force. That means the body then has to do a lot more, exerting extra effort and using significantly more muscle power to get it done. And please, try to imagine I'm pulling here and I'm pulling over there. Where does that pull ultimately go exactly? Of course it pulls down here, and the force acting on the joint will increase noticeably. Before it might have been like this, now it's like this. And now months go by, years, decades, and more muscles just can't really relax anymore, and the diet isn't good. There's too much acidity. The connective tissue dries out and starts to stick together more and more. It's like more and more brakes are being applied to your strength, more and more. The body fight's giving in. If you're older, well, by then at the latest you know it. Or when you're doing strength training, you sometimes think, oh, why can't I bend my arm properly anymore? That's a lot harder than it normally should be. That freedom, that lightness keeps getting lost more and more because of these opposing forces. And then this effect keeps going. At some point the counterforce is here, then you can build it up here again, and you immediately notice, oh man, the resultant now barely even manages to clear the joint anymore, practically scraping past it. So that means it has to be pulled pretty hard. The force has already gotten a lot bigger here than over there, just to even make that actually work. And then it keeps going, and eventually it happens. My resultant is right in the joint, exactly where everything comes together, just there. And then they say, oh, this joint is blocked. These are the patients, the people who are suffering, who go to a clinic to get help and hopefully find some relief. So they come in and the doctor says, raise your arm. And they go, I can get it up to here, but it hurts so much I can't lift it any further. It really, really does hurt. That's what happens when muscles keep shortening and the force on the joint just keeps steadily increasing over time, further raising stress on it. And we don't want to go into the pain too much now, but just this simple point, the more counterforces build up, the more the trunk shifts over here, and the more it has to be pulled really hard. The more stress enters the system, the more the body will eventually respond, triggered by the brain, and will in turn react with pain signals or protective tension. Now let's add pain in there, in the muscle that by pulling would trigger the counterforce and ultimately, through this action, transmit force into the joint, changing how the joint is loaded and moved. And you can just picture that. You've got two bones here coming together, and if everything's within the normal range and the forces are low enough, it'll move smoothly and without any abnormal friction, catching or pain, gliding just as expected. That would also cause a bit of wear. Anywhere something moves, where one surface slides against another, if there's relative movement over time, a little will always wear away and gradually accumulate thereafter. But the body just repairs it. We know that stem cells basically migrate in, and because the body is set up to fix things again, it effectively restores the damaged tissue over time. And that's no problem at all. But now we additionally have this particular view here simply makes them press together slightly more when moving around. So that's still okay. The movement becomes a bit harder and the joint transfers that force onward. Now, imagine you have a surface and you gently go over it with a piece of sandpaper, just lightly brushing it with small movements. Not much is going to happen. Now imagine, compare that. The same movement, but you increase the pressure and then move back and forth again, and then do it once more, slowly and deliberately. And then more will happen. The mortar and pestle is a good illustrative example. If you've got a mortar, put peppercorns in and set the pestle on top, just move it a bit and almost nothing at all gets crushed. But if you put the pestle in there and press at the same time, press axially, like really push it in so the pestle is pressed against the pepper, and then move it, maintaining steady downward pressure as you twist and grind slightly. Then quite a lot happens. The pepper keeps getting ground down, it becomes finer. And you can pretty much compare that picture to, basically, the very first main reason overall. I'll put a 1 here. Let's make this a little bit shorter for now. The load's too high, I'll note that down. The load's too... That's the first reason for our osteoarthritis. That'll cause far more wear than necessary because the forces acting on the joint are much higher than what the body actually wants or is built to handle. But that's just how it is. And the people who suffer from it keep moving because they have to. I was just about to say to grab their wine bottle, but kidding aside, they carry on regardless. They have to keep moving, so they push themselves. And it's under that effort that the movement happens. But mind you, the cartilage underneath really suffers quite badly. So now we said the following. We said that whenever the forces here get bigger, more happens, pain comes, and we said movement itself in our everyday life is no longer fully complete in both directions, which limits how people actually move day to day and affects their normal routines. But maybe it only happens in that area now, or only on one side, not the other, and so on, in everyday life. What does that mean for the cartilage? Look, if the full range of motion that's biologically meant goes from here to here, then biology defines that, its normal limits, purpose, and how it should function. Then the cartilage is loaded across the whole surface, so it's constantly being compressed, waste products squeezed out, then released again and again. But if, through our daily routine, from not moving enough and even more so because the pain makes you not want to move into it, it becomes noticeably smaller and tends to stay that way over time. For example, only from here to here. Then you can easily see that with this angle missing and that angle missing, the cartilage gets compressed and released less than before, so over repeated steps and everyday use it no longer cushions or spreads the load properly and therefore wears down more quickly, causing earlier, faster deterioration over time than it's normally biologically meant. And so, second reason for osteoarthritis, for the cartilage wear, is limited movement, namely reduced joint mobility overall. Slightly tight. Movement, and to the doctors among you, the orthopedic surgeons who operate, you know the effect that in certain joints, it's not that all the cartilage is gone, but some spots are still present, other spots are completely missing. I've been told I've never operated. I'd like to do one sometime to look, but Orthopedists training with us keep saying, they told me, for example, there are cases where there's still cartilage around the edges, and in the middle it eventually becomes bone on bone, like a bald spot, so to speak. Or the other way, cartilage is still central and bone on bone outside, where the cartilage kind of wears away. Is my explanation really clear? I asked them, what's that about? Shrugging, because the underlying biomechanics just aren't there for that idea. But I'm telling you, it's because of the way the movement happens. If the movements are such that the middle of the cartilage isn't being loaded anymore, however that may happen given the shape of the joint, the cartilage will start to slowly break down there over a period of time. If the edges stop being loaded, it will start to break down there because the cartilage essentially becomes starved of nutrients. Now we've already got two things happening at once. Number one, the pressure, the movement, is happening at an intensity that's far too high for our joints and tissues in our bodies. Like sandpaper, press down hard and rub. And number two, the movement gets more and more restricted because people use less and less of their full range of motion. The cartilage doesn't stand a chance. So by the way we behave, without even realizing it, most people don't, we're unintentionally causing our cartilage to slowly and progressively break down, that it has to take on far more wear than it can make up for, and so on. There's a third reason. And the third reason is pretty clear, because we said the synovial fluid around here feeds and nourishes the cartilage, keeping that tissue supplied and healthy. So what's in the synovial fluid? It's got the nutrients and compounds we take in through our diet, the vitamins, minerals, and other building blocks which nourish the cartilage. Because to repair something, you need repair material. And thank God we're not houses, because then you'd have to go to the hardware store and buy stones, buy cement, and several other building supplies. How do we do that? Basically on the side, through our diet. Because our diet supplies all those substances that the cartilage uses to feed itself and to regenerate, keeping it nourished day after day and enabling continuous repair and proper maintenance. And when it comes to nutrition, so very much goes wrong. Petra, my wife, is a nutritionist. She's been practicing as one for 40 years. She keeps saying over and over how people eat and what comes out of it, what diseases that causes. We won't get into that now. And that's an important point to remember, really. But one thing's clear, if we eat high quality food, then these substances here are high quality. If we eat low quality food, then not much gets through that helps the cartilage regenerate. And so I don't tell you anything wrong, I'll make it a bit hands-on. So point number one, this is all collagen. Type 2, that's what we've got here, that's the name. You don't need to worry about it. So we need to eat in a way that lets us build collagen. And for those of you who still eat meat and stuff, the tried and true home remedies are, of course, bone broth, chicken skin, and gelatin. Simple, time-tested options many people swear by to support skin, joints, and overall connective tissue. Vegetarians and vegans say, I'd rather not, but they still need glycine and proline from other sources. And then hydroxyproline. Those are substances that are pretty important there. Could you please set it down just right over there for me now? And to get them, you've got oats, wheat germ, cabbage, and asparagus, among other common, readily available foods. And proper vegan collagen boosters are vitamin C and amino acids overall indeed. So the cartilage has the necessary building material to properly put everything back together, what's there, or if it's gone, to rebuild it. On the one hand, it's preserving what's there, and if more is already gone, I want to rebuild it, and then I need the same materials. Number two, I need sulfur-containing stuff. Sulfur-rich veggies, broccoli, Brussels sprouts, onions, and what I really love, garlic, leeks, and all kinds of cabbage, of course. And they help make sure, for people who no longer have them, that the cartilage stays elastic and resilient, so it can withstand certain forces and not wear down too early. And number three, I need vitamin C, because vitamin C is basically the vitamin that helps all the connective tissue build up properly and stay strong and healthy. And if you just eat fast food, only junk processed to last, no vitamins, nothing fresh and so on, then your body just keeps breaking down bit by bit over time very slowly. And that means that comes in as a third factor, that the little what's already limited, what actually diffuses into the cartilage, that the few things aren't really capable of doing it properly, to properly supply the nutrients needed to regenerate it, or rather to enable real repair and a gradual restoration over time, to build it back up. And now, so that was number 3, I'll just call it poor nutrition, plain and simple, nothing fancy, you know. But now you're probably wondering. The whole time, Roland keeps saying it's actually rebuilding right now. But I've always heard knobble, it can't grow back, that won't happen. There's no way it could ever regenerate at all. I was somewhere and they told me, you've just got to accept it now. The tread on your tire is completely worn out. We need to change the tire immediately. That refers to artificial joints. And that's just that old knowledge, you know, really, to be honest. Oh, it's really, really hard to eradicate. I mean, already 30 years ago, we saw cases where we could watch cartilage rebuild itself in some patients right before our eyes. We've been saying this for 30 years, and even now most still say, no way, that's not true, that can't happen. Honestly, what on earth is he on about? And now I'll give an explanation of why I think. This huge misunderstanding, this error, this mistake, that cartilage can't regenerate, why it sticks so stubbornly, and why it's so hard to change, especially in clinical practice and everyday thinking. I can totally see that. Which doctors deal with osteoarthritis the most? Those would be the orthopedists themselves, of course. And then a patient comes in who's in pain, and then the pain's gone again, just like that, suddenly. But the orthopedist had already noticed there's actually someone who has a problem with their knee, for example, a year later. Either that acid shell is still there, the pain's stronger, and he still can't get through even small things like taking painkillers. The pain just can't be eased. It stays. What happens then? Then they do the first exam, the very first imaging scan immediately. And now the scan comes back and it says, okay, the cartilage gap has gotten a bit thinner than before, showing a slight narrowing. That's a sign. On the X-ray, you can see the cartilage is closer together. If they're closer together, does that automatically mean the cartilage is thinner? So the orthopedist will think there's basically pain and that the cartilage has become noticeably thinner in that joint over time, and then say, well, that's exactly what's causing the pain. Kind of two things at the same time. I always say, look, if a bell rings and it's raining at the same time, that doesn't mean it's raining because the bell rang or that the bell somehow caused the rain. So just because two things happen at the same time doesn't mean they're actually causally linked at all. Coincidence can easily make them appear related. But in medicine, there are many such things which, simply because they occur at the same time, are commonly treated and assumed to be causally linked together. And then 2 years later, the same patient comes back in terrible pain. They do another scan, and you can see, oh, the cartilage, how do I put this? Maybe I should redo it and rethink the whole repair plan immediately. And then we'll zoom in a little more so you can see exactly what's going on here. Let's go back again. Originally, the spacing was like this, so basically from here to here. And that's why the cartilage had to be the same exact thickness, like once here, and once here, and then. It was already less. What was that like then? It was basically just the bone. Closer, so. Now he didn't go all the way there, but maybe only that far. So the gap had already gotten considerably smaller than before. And then he came by, we'll remove this down here. Then you would see, okay, maybe like that. So there are just bits of cartilage left here. I've got to remove the stuff down there too. It's gone anyway. There are only bits left here, a little here and a little there. The rest is bone on bone, basically bone on bone, so to speak, completely worn down really badly. And there, of course, just for the feeling, yeah, everyone immediately thinks, for God's sake, how much does it really hurt right here in this exact spot right now? What kind of pain do you get when it's bone on bone? There are two important things to note. Point one, pain behavior. Let's tick that off. From 30 years experience and hundreds of trained therapists, we've seen it time and again, and studies confirm it. That when the cartilage cushioning a joint is gone and bone rubs on bone, pain patterns and intensity can vary and aren't always predictable or necessarily very severe. Before, I'll say it again. That used to be practically so much thicker. When the gets a bit thinner. So if the bone then reaches up to here, that has absolutely zero to do with the pain. And another point is that cartilage has no pain receptors at all that could possibly trigger the pain in any way whatsoever. They aren't in cartilage. And when you then ask this conventional wisdom, yeah, why does it hurt if cartilage has no pain receptors? Then there are, to me, these are just evasive answers. Yeah, the cartilage itself doesn't hurt, but it's all inflammatory, so it does hurt after all. You just try to explain something to yourself that really can't be explained? No way. We know from our therapy that if at the moment when osteoarthritis has already started and the cartilage has already gotten a bit thinner, if at that moment you normalize the muscle tension, then the pain is gone. And that again proves it's not the cartilage or osteoarthritis causing the pain. And that works for osteoarthritis, first, second, third, and even fourth stage, when bone actually touches bone, truly so indeed, without fail. Even in those cases where everyone says, that has to hurt now, bone on bone, that really can't be good. Even there we know from experience. For reasons I can't explain yet, that people are actually supposed to in practice. Please look into why that's the case. We'll prove it to you by simply taking away the pain, then you still have to find the explanation. But even then, because there are pain receptors in the Knorenhaut, still, the pain is drastically reduced or gone when you normalize the muscle tension once the tension eases. But we don't need to worry about that right now, because what's really at issue is what happens to the cartilage now, and why an orthopedist or other people might be concerned about it. Who've worked on this professionally for many years and come to that conclusion, I can totally understand that. He kept seeing cartilage getting thin, pain getting worse, cartilage gone, pain enormous. Then they put in an artificial joint. That's the world. And now I'll put another world up against it. So here we've got a situation where the cartilage is already very thin, almost worn away, and causing more pain. There's hardly any left. We know that in these osteoarthritis cases, there are ongoing inflammatory processes happening inside the affected arthritic joint, which contribute to pain, stiffness, and further deterioration. Of course, what is inflammation? It's a repair process. The body is actively trying to repair the damaged tissue. Stem cell research shows more stem cells here, and they clearly want to help repair the tissue, actively taking part in healing and regeneration around the injury. But nobody knows why that doesn't happen. So they take fat from somewhere, isolate the stem cells, inject them into the knee, and so on. Stem cell researchers tell me it's very doubtful those cells relate to knee stem cells or are even capable of functioning or integrating into knee tissue in any meaningful way. Change like that to help there. You have to mention that in passing. Anyway, let's think about why, if we want stem cells to repair the cartilage, why these cells in the first place, the repair doesn't take place. And if you've followed me this far, you can easily answer the question. It's obvious from the steps we've just gone through. But since I can't hear you, I'll answer. It's clear, really. If the forces here, via the processes we examined, are changed as we've seen, they cancel out or fail to produce the needed repair. If these forces are still just as large, then that means they destroyed the cartilage beforehand. And then they'll even more destroy those little attempts, those tiny, delicate new cartilage cells trying to develop there, wiping them out before they can properly form or mature. That means cartilage regeneration can't happen at all if the pressure from the pulling tension of the muscles and fascia is still exactly as high as it was before. It'd be ridiculous if that suddenly worked. But, and here's the first big piece of evidence, it was already, I think, back in 2006, believe it or not. He's at Utrecht University in the Netherlands, Professor Dr. Mastbergen, I think. Please link the study below so people can check it themselves. They found that if you put a mechanism on the knee, that basically pulls the joint space apart so it becomes noticeably larger than its original size by a measurable amount, not the other way round, like this, and so on. That the bones are further apart again, so there's noticeably reduced pressure on them. That the cartilage then regenerates within 6 weeks or 3 months or somewhere in that general time frame, give or take, more or less. And that proved it. But those doctors were totally laughed at the conference where it was presented, openly ridiculed by many attendees and peers. They then did. Another follow-up study, I think about 5 years later, if I remember correctly, I believe, which showed that the cartilage they'd gained and the pain relief that came with it, that these effects also persisted for a noticeably long time afterwards. You're probably wondering why the pain was gone if it had nothing to do with the cartilage. It's really, really simple. Just think about it. Mechanically, these bones here are being pulled apart. There are muscles attached to them, you know, and what if this knee gap, this joint space, is widened by approximately 0.5 centimeter? The muscles and fascia have to give too, so that was from the outside a bit bloody, a built-in stretching machine, essentially and unmistakably. And then the cartilage could regenerate again, and now the bridge leads into our Liebscher glory exercises. What do we do during these exercises? We ease the excessive tension in the muscles and fascia so the bones aren't pressed together as much. And that's why we've already seen in patients and even in therapists who've tried it on themselves that the joint space has actually become noticeably and measurably thicker again in many cases. That means cartilage has grown back there. So this isn't going to suddenly make the whole world stop thinking it can't be done, nor make skeptics instantly change their minds. Keep an eye on the relevant studies. We've linked a few down below that provide strong evidence. The best test, try it on yourself, and now again. About your own situation to explain what you can do. If you've got knee pain or pain in another joint and you're told it's due to osteoarthritis, that's what you're generally told to expect. And even if that osteoarthritis, that thinning of the cartilage, has actually been shown, don't let it stop you from believing you can still take active practical steps to help yourself fully recover again. Just do the exercises that go with it. If it's the knee, do the knee exercises. For the hip, the same. For the thumb, the same. Everywhere osteoarthritis shows up. We've got exercises online. Please do those or go into our app. It's set up so you can access them directly. Do the exercise and monitor your pain levels closely. And I guarantee you that in most cases, the pain you have with certain movements or positions, the pain that was 100% before, can already be noticeably better after the very first exercise session, often right after you do it, sometimes immediately. I see it over and over in thousands of cases. There are exceptions though. You might have to practice for 2 days, maybe 3. But give it a try and you'll notice, in most cases, and for you the chances are very, very high, if you give it a shot, something will change. And then you'll know that the pain you're feeling really has nothing at all to do with how severe your osteoarthritis actually is, truly, honestly. Because we're not changing the osteoarthritis, right? If you do an exercise for 2 minutes, the osteoarthritis is still the same. So if the pain is less afterwards and the osteoarthritis remains completely unchanged, what does that mean? The pain isn't due to the osteoarthritis, it's caused by tension in the muscles and fascia. And then you just keep going and pretty soon you'll be pain-free. That's a great chance, yeah. If you can't manage or worry, I have osteoarthritis. Should I do those exercises? Yes. Then ask your doctor, but ask one who's open to new research, yeah. And one more tip that just came to mind. Cartilage needs pressure now and then to regenerate. The more it gets, the better. But pressure without movement is what's truly needed right here. That everyday movement with the high pressure destroys it. But an exercise where you basically stretch the muscles and the joint stays in the same position, it simply presses the rubbing surface down more firmly and more consistently over time. But there's no where then. You press down for 2 minutes so the whole tissue can line up properly because it reaches right down into the genetic level of the tissues themselves. It goes right into genetic information. What happens when you practice? What happens when you stretch and train? And the body needs those mechanical stimuli. Ultimately, too, in order to rebuild cartilage properly. So as far as I'm concerned, you can do these exercises totally risk-free. But if you're unsure, just ask your doctor what they think and follow their medical advice closely. Definitely, if you then notice, oh, the pain's easing, I'll tell you, the moment the pain eases, it means the muscle tension has become pretty much normal again, at least not as destructive as it once was. And then, at the very least, the osteoarthritis will finally come to an end. Maybe the rebuilding hasn't kicked in yet, but I'm saying you need to check for yourself whether that's true for you too. I genuinely believe the chance is very, very big and quite likely for you that you'll get wear and tear then. Even though you keep moving, it's with reduced tension now, it doesn't get any bigger. And I'm saying, and we observed it over periods of about a year to a year and a half, that something clearly changed noticeably in a persistent way. With the exercises and by gently relaxing the entire situation, everything began working properly once again. And yes. Finally, could you say a short word about the operations? Why are these artificial joints used in the first place in modern medicine? They're used in the vast majority of cases because there's severe pain. I haven't yet seen any of our patients who, after the pain was gone, despite the osteoarthritis, later suffered recurring pain. Opt to have an artificial joint. Most people don't want that. They often say, I really don't want metal inside my body ever, honestly. I'd also say, wait as long as you can. If the pain goes away and you later notice there are still problems and eventually it just won't work anymore, you can always have it done then. But most people end up canceling their operations with us, simply because the pain's gone completely. And it'll probably be the same for you. And with that, we're done for now. If you have any questions, drop them in the comments and now give it a try, so you'll probably be affected. If you're not affected by osteoarthritis yet, or you don't even know you have it because it's painless, because that happens very, very often, do these exercises anyway, because you can't do anything better than prevention. It prevents problems, pain, and osteoarthritis from developing. And this topic, you know how important it is. We even wrote our osteoarthritis book about it, and you can read lots more details there online right here now. Please spread this, tell people about it, talk it over with others. Feel free to ask your doctor or your naturopath or your podiatrist what they think and pass it on. Share this video. We need this awareness. These connections should really be taught to kids in every school, or at the latest at university, so people know what they can do to avoid getting osteoarthritis and not have to deal with pain. Because once you know how, it's not that hard. It just takes a routine and the understanding that I have to do something about it, that the tension in my muscles and fascia normalizes.